Today let's get a precise knowledge about gout. Gout is defined as uric acid disturbance and inflammatory response to MSU. MSU are monosodium urate crystals. These are formed secondary to hyperuricemia. Major clinical manifestations of gout include acute synovitis, erosive or destructive arthritis, tophi, nephrolithiasis, and nephritis. Epidemiology of hyperuricemia is different from gout. In males, normal levels are 3.5 mg per dl, 4.7 mg per dl in female. Incidence is around 0.2 to 0.3 in 1000. The pathogenesis of urate crystals. Uric acid is a weak acid present mainly as urate. This urate crystallizes as MSU in and around the joints. MSU crystals are released into the joint cavity. White blood cells engulf the crystals as immune system mechanism. Meanwhile, plasma membrane releasing toll-like receptors and cytokines. Activation of endothelium takes place, and further activating the synovial lining macrophages and monocytes, causing inflammation. Let's discuss the clinical features of gout. Clinical features are divided under 4 phases. Coming to the first, asymptomatic hyperuricemia. This may never lead to gout. In acute gouty arthritis, serum acid levels are not elevated because medication increases the exertion of uric acid in urine. Also decreases the concentration of uric acid in blood plasma, where affect is achieved by proximal convoluted tubule. The asymptomatic hyperuricemia is capable of promoting hypertension and vascular diseases. Acute gouty arthritis is the second phase of gout. The classic site of gout is the big toe. It starts at night. The joint becomes very painful, swollen, hot, reddish, and shiny. If left untreated, it may lead to cluster attacks, affecting other joints. Third phase is intercritical joint. After the first attack, second attack may appear after several years. The frequency of attacks gradually increases with time. The fourth phase, chronic gout, autofascious gout. This depends on uncontrolled hyperuricemia of long duration, more than 10. They may last from 3 to 45 years. Tophi appears as firm, nodular, fusiform, swelling. In ulcerated tophi, skin is white, chalky. In inflamed tophi, skin appears erythematous. Let's discuss the management of gout. Alcohol abuse should be avoided. Avoid taking high purine intake. To treat chronic gout, we must lower the high levels of uric acid. Guys, avoid overexertion, dehydration, and starvation, and stay healthy. Thanks for watching, and don't forget to subscribe.